Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist. And you are watching Obesity Special MEDtalks with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 1063वां 1063rd एपिसोड है. Let's have the headlines for the day. Now, the number of cases of diabetes across the world has quadrupled. 4 गुना हो गए हैं since 1990. And now diabetes affects more than 800 million adults. 80 crore adults across the world, according to a World Health Organization survey. Consumption of ultra-processed and fast foods is the leading cause of diabetes in India, reveals a new study. तो हमारा जो खान पीन है जो बदल रहा है उसकी वजह से डायबिटीज बढ़ रही है. But breakthrough stem cell transplant अभी भी इस पे रिसर्च हो रही है चाइना में. So breakthrough stem cell transplant in China offers hope for type 1 diabetes cure as well. And another drug which we hope will soon be available in India, tirzepatide. Treatment with tirzepatide in adults with pre-diabetes and obesity or overweight. तो जिनमें pre-diabetes है उनमें भी tirzepatide leads to sustained weight loss and 99% of them remain diabetes free at 176 weeks. तो 3 साल से ज्यादा के follow-up के बाद 99% को diabetes से हम बचा पा रहे हैं. And yet another study suggests that vitamin D supplementation may improve glucose levels and reduce inflammation in type 2 diabetes. Now, with these headlines, let's go to our topic for today. Let's see what the heading is. The headline is Diabesity. अब ये भी एक न्यू डिजीज है या पुरानी डिजीज है, डायबिसिटी. एंड फॉर such a topic जहाँ पे दो चीजों का मिश्रण हो रहा है, we need a specialist. We need someone who is very good at both aspects of diabesity, and that's Dr. Prem Narayanan. We'll welcome him shortly. And there he is. Warm welcome, Dr. Prem.
Hi. Good evening, sir. Thank you so much.
So Dr. Prem is a warm welcome. He's a distinguished consultant, and he enters like Superman. He is a distinguished consultant and head of the Department of Endocrinology and Diabetology at Ahalia Diabetes Hospital in Palakkad, Kerala. He's also the medical director there, and many of you would have seen him, one of the most dashing and the most handsome personalities on social media. And he keeps the flag of Indian endocrinology, Indian diabetology flying high. So warm welcome, Dr. Prem.
Thank you so much for the kind words.
And we have greetings for you from all across the country. Swapna Jain ji from Vellore, Tamil Nadu, sending you a good evening. Dr. Mohan T. Shenoy, Dr. Ganesh Ambore, and Vinayak Sharma ji. Everyone saying good evening to you.
Yeah. Hi, Mohan. Everybody, good evening.
So, Dr. Prem, this topic, diabesity, what does it mean? We know that there is a disease called diabetes, and then we also know there's a disease called obesity. But diabesity we've not heard before. What does this mean?
Yes, sir. So as we know, the term epidemic and even pandemic are now quite familiar to our public. Say after the COVID, people are very well aware of this, especially the term pandemic. So as we know, COVID was what we say is a communicable disease, or it was a communicable disease. Among the non-communicable diseases, the pandemic is that the two other diseases are the diabetes and obesity, and this is very silently creeping into our society. And most of our people are not much aware about what is happening until and unless they become at a point where they are the body is showing down, or even they are forced to take some pharmacotherapy or the medical agents to correct the problem or the metabolic syndrome. So diabesity is, as sir had put up, it is a combination of diabetes and obesity together, and that's what we see in our country also and across the world also. So I would say at least 2/3 of people with diabetes, especially type 2 diabetes, that is the commonest diabetes that we see across, 2/3 will be having either overweight or obese. And we know that is one of the major driving factor for the dysglycemia or the diabetes and the later on the complications that we see in our clinical practice. So this is a twin epidemic, that is a diabetes and obesity putting together, because they coexist in the same patient in most of the clinical condition of lifestyle syndrome that we see, sir.
So diabesity, that means is two diseases in one word, right?
Correct, sir.
So, and you use the word two-thirds. Would that be true for your OPD? Would it be true for Kerala or for the entire India? Two-thirds of
Definitely.
all.
Entirely. I mean, because we know that the cutoff of the BMI or the body mass index is different for Asians, especially compared to the Western populations, the Caucasians, others. It is entirely different, and our cutoffs are much lower because we always say that Indians are more prone for diabetes. Various reasons, and even people we see and we see that, we might see that his BMI is normal, then why he's having diabetes? But the fat mass is definitely quite higher in the Indian population, especially the belly fat that we call about as the abdominal adiposity, and that is very much high in our population, and that is also one of the major driver for the diabetes and the metabolic syndrome.
So two-thirds of all people living with diabetes will be obese or overweight. And
Yes,
even
sir.
if you can't make out from afar or from the BMI, they would be having extra adipose tissue. Would that be
Correct, sir.
right? Yeah.
Yes, sir.
And let's ask everyone, people logged in from across the country. So, do you feel this is true for your state, for region, city, wherever you work? Do you think that two-thirds of people with diabetes are obese or overweight or maybe centrally obese? What about the reverse, Dr. Prem? Can we say that two-thirds of all people living with obesity have diabetes or dysglycemia, or
Yes,
will develop later?
definitely. On the other side, it is that most people become conscious about obesity only after they become diabetes. That is the very sad part, because
Yeah.
they're till then they are not very much conscious, and they do not consider them obesity as a disease. And until what we see is that diabetes is diagnosed, then the reverse goes back. But actually, the putting up true is that yes, obesity is one of the most forerunner for the diabetes or the type 2 diabetes, the fatty liver and all the driving force leading on to the dysglycemia.
A warm greeting to you, Dr. Prem, from Dr. Ramesh Pal Singh Pawar, who is a
Hi,
73-year young pediatrician from Western UP. So
nice,
he
nice.
sends his regards. Yeah. And there's a question from Dharvinder Dhavanji. He says, I've been suffering from. So, first of all, Dr. Prem, would this sentence be correct? I've been suffering from hyperglycemia or suffering from diabetes. What would you like to say to Dharvinder ji?
No, I tell my patients diabetes is uh, not a disease, I would say, or you should not call yourself as a patient, but it is all about another way of life, leading another way of life, because that is the correct way actually. But our system has gone to such a level of industrialization and commercialization that the food industry has gone way ahead, and to a point where that even most of our governing systems are not able to control many of the things that are happening in the food industry. So that is actually the correct way of life. Leading the correct way of life is what will result in the remission of diabetes that we also always talk about. That's what we need. But yes, another important thing is that the palatability of the food or the taste. That is one thing that forces us. Even I would say, even all we doctors are also no exceptions. We are also human beings like all of you. So that is also. The palatability is also one of the major driver for the different taste of food, because we know that biryani tasting in Kerala will not be the same taste we will be getting in Punjab. It will be entirely different. So the variety of taste with the four tastes, if we know that yes, the four major tastes, and there is one another fifth taste sensation also, but all putting up together, the different taste that we feel with the same food or the same name of the food is entirely different in different parts of the country, and even in different regions across the state also. So that was one driver that many times most of the people will not be able to curtail their drive for food, because we know that now social media, Insta, and YouTube and all are used to such an extent that people go just for dinner. They drive 50 kilometers, 100 kilometers. They have their dinner and come back at night. So this is also happening, especially among youngsters. So yes, food is one thing. I would say it is an emotion, but emotion that has to be controlled also.
There's a good evening coming your way from Nepal, Dr. Prem,
Hi,
and Manas Thapa says hi to you.
hi,
Dr.
hi. Good
VK
evening.
Goel also says hi. Yeah, Dr. Goel sir. And now we have Obesity MEDtalks every Monday, 7 to 8 p.m. Indian time, and 7:15 to 8:15 p.m. That is Nepal time. Coming back to Dhavanji's question, he says I've been suffering from hyperglycemia. तो डॉक्टर प्रेम क्या कह रहे हैं कि सफर शब्द इस्तेमाल करने की जरूरत ही नहीं है. You don't need to use the word suffer. You say that I'm living with diabetes and it's an alternative way of life. आसपास का वातावरण बदल रहा है, the environment is changing, the stimuli that we get, खाने पीने की जो चीजें हैं, the challenges that we get, they are changing, so we should also change. Now coming to Indian philosophy, जो भी आपकी सोच है, उससे आपके अल्फाज बनते हैं, आपकी शब्दावली बनती है. Whatever your thoughts are, from that you get your words. उन लफ्जों से, उन शब्दों से आपकी एक्शंस आती हैं, your choices. So if we are able to take care of our thought process and then take care of our words, like I stop using the word suffering, I start using the word living happily with diabetes. Diabetes happiness. Automatically my behavior will change.
True.
So that's what Dr. Prem is trying to tell us. But Dharmender ji has another challenge. He says 15 years ho gaye hain diabetes ko. So see, look at it from a positive point of view, Mr. Dhawan. You've lived successfully with diabetes for 15
Correct.
years. How many people are able to do that? Not many. But garbad hai, HB1C is 13 now. So Dr.
Oh,
Prem, what does HB1C 13 mean to you? And what does living with diabetes for 15 years mean? So what should we do now for Dhawan sahab?
yes, sir. Dhawan sir, chinta mat kariye. One thing is that again, changing your lifestyle practices. I would say GLP, good lifestyle practice, is definitely required for you, or else we will be forced to give you GLP-1 agonist. So HbA1c 13% is definitely quite on the higher side. So as the duration of diabetes is increasing, it is very important that the glycemic status is also maintained, or else the risk for the complications that we all doctors talk about, the chances can increase. To each, we cannot never predict to what extent each of your complication risk is increased, but definitely overall the risk will be at least doubled compared to a person having a normoglycemia for the past 15 years. So, Dhawan sir, I mean, if you are on medications and all, there, I mean, pharmacotherapy change might be required. Before and all, as I said, GLP is definitely important. Changing your lifestyle and the dietary practices is definitely important, because that will definitely bring down your glycemic levels of the HbA1c also to a better glycemic status, so that you don't end up in any of the complications that we always doctors talk about. Because as doctors, we also want each one of you to avoid the complications, because each specialty is burdened with such a lot of number of patients with complications, because the morbidity with the diabetes is much higher than the mortality. Mortality also increases definitely, but the morbidity, because having a disabled life is one thing that is that we can put it up. There is a quality of life, or the QOL that we talk about, definitely comes down with the complications, because one thing is that the frequent visits to hospitals, again frequent monitoring, then pharmacotherapy, all these things adds to the financial burden also. Then and then absenteeism from the work because of the disease. All these things can increase. So, Dhawan sir, please try to bring down your HbA1c to a better status, and also look into or monitor or observe or examine for the complications, or if any end organ workup that we always talk about in diabetes is also definitely at most essential for you at this point of time, so that after 3 months, if you are when you come back for the another talk, we want your HbA1c to be below 7%, and we want to hear it from you.
Thanks a lot. And this also answers another query that Mr. Dharmender had. He said, I can't get rid of sweets. So when you said GLP-1 receptor analogs, these are drugs which will help control the diabetes, help reduce weight, and also reduce your appetite for sweets. So multiple फायदे होंगे धवन साहब.
Correct.
So we're speaking of diabesity, we realize it's two diseases together, diabetes and obesity, and we are taking a rough cutoff of maybe two-thirds. Two-thirds of people with diabetes are obese or overweight or maybe have extra adipose tissue. And maybe two-thirds of people with diabetes with obesity will sooner or later develop diabetes if we follow them up for long. एक स्टडी थी आईसीएमआर इंडायब. तो आईसीएमआर इंडायब 17 के जो रिजल्ट्स आए, लेट अस जस्ट पुट इट इन सिंपल वर्ड सो दैट वी कैन ऑल रिमेंबर, एंड वी रिमेंबर यूजिंग द नेम ऑफ द कैपिटल ऑफ कतर. तो क्वेश्चन फॉर एवरीवन, व्हाट इज द कैपिटल ऑफ कतर? इसे हम याद कैसे करते हैं? D for diabetes or dysglycemia. 25% of adult Indians have dysglycemia. This is all states put together. There will be some states and union territories like Goa, Pondicherry, Kerala, where the percentage is much higher. In Haryana also, dysglycemia is 30%. But for average India, 25%, D for dysglycemia. O for obesity based upon body mass index, 30. 25 से 30 हो गया. H for high blood pressure, 35. So D for diabetes, 25%, or dysglycemia, that is diabetes and pre-diabetes put together. 30 will be obesity, generalized obesity. 35 will be hypertension, and A, that is Doha. So और हमने आंसर भी दे दिया ना, we gave the answer to our own question, right, Dr. Prem? So Doha याद करके, A is for abdominal obesity, that's 40%. So 25, 30, 35, 40, that's the way to remember. But जो highest percentage है वो आता है dyslipidemia का, and if you include low HDL and high triglycerides, which are the commonest, that goes to 80% in the country. So 25, 30, 35, 40, and then a jump to 80 for dysglycemia. Greetings to you from Ujjain, Madhya Pradesh as well, where Dr. Pradeep Rawal is based, and from Himachal Pradesh, where Dr. Vipin Sharma is based. And Ritu Kumar pointed out Doha. तो दोहा से हम याद कर सकते हैं अपना epidemiology. And thank you Swapna Jain ji also for pointing that out. Bimla Kapoor ji भी good evening कर रहे हैं, and a point that is raised is we were speaking about taste. Now धवन साहब ने भी कहा टेस्ट को मैं resist नहीं कर पाता, I want sweets. डॉक्टर प्रेम ने बोला 4 टेस्ट हुए हैं, नहीं 5 टेस्ट हैं. But actually Ayurveda mentions 6 tastes. So question for everyone again, what are the 6 tastes that are mentioned in Ayurveda? And this is called gustatory medicine. If we can work together, all people living with diabetes, dietitians, nutritionists, and doctors, endocrinologists, everyone together, we can actually develop the field of gustatory medicine. And then we can specify specific tastes for different people. So जैसे धवन साहब का अगर हमें height weight पता हो, we have a fair idea of whether he is obese or overweight or maybe malnourished, lean, in between. We can suggest various tastes to him. ताकि इनकी स्वीट्स की जो रिक्वायरमेंट वो कम हो जाए. दैट इज कॉल्ड गस्टेटरी मेडिसिन, एंड दिस इज अ गुड कॉन्सेप्ट फ्रॉम आयुर्वेदा. बट ये करने के लिए फर्स्ट वी नीड टू नो द 6 टेस्ट. सो दैट्स द क्वेश्चन फॉर एवरीवन. सो डॉक्टर प्रेम, व्हाइल वी आर ऑन दिस, वी नाउ नो व्हाट डायबिटी इज, बट अब 2 बीमारियां हैं. सो डू आई नीड डिफरेंट ट्रीटमेंट फॉर डायबिटीज एंड डिफरेंट ट्रीटमेंट फॉर ओबेसिटी, और इज इट जस्ट द सेम ट्रीटमेंट?
Yes, actually, obesity is a forerunner as we talk about for diabetes, especially type 2 diabetes. Type 1 diabetes and pancreatic diabetes entirely different scenarios, and other syndromic diabetes. But type 2 diabetes, obesity, and diabetes, or type 2 the dysglycemia are actually two sides of the same coin. And if you are tackling the obesity indirectly, it is also going to reduce your glucose level. And so that is what we all require also, because reducing the weight, because we know in our patient, in our OPD also we see people bringing down their weight, and then even the glycemic status goes back, or even some people go into remission also. As we were talking about, sir, obesity, the sarcopenia, or the low muscle mass, is one of the major feature that we see in our Indian setting, because in our OPD, as most of you have been having a body fat analyzer. So when we see the reports of the body fat analysis, especially when in females also, what we see is that fat mass is quite high and the muscle mass is too low. So this sarcopenic intent that we talk about is also one of the major, I would say, the predictor for the onset of the metabolic syndrome. Improving the muscle mass is also very, very important. And so tackling in that way, like reducing the body fat and improving the muscle mass will definitely in turn will bring down the glucose levels also. I mean, recently also one lady, she was having fatty liver and all, and she was on OEDs and all. And after giving or advising good lifestyle, intensive lifestyle modification, she brought down her weight by 6 kilograms and her HbA1c without any anti-diabetic medication for the past 3 months. Now it is just 5.9%. So this is what we call about as a remission of type 2 diabetes. It's not the reversal. Reversal is a wrong terminology or a misnomer. The correct terminology is a remission of type 2 diabetes. Yes, remission of type 2 diabetes is always possible, but yes, no, maybe not for all, but definitely worth a try with a good advices from the your treating doctor and nutritionist putting it together. Those who are with a lesser duration or low duration diabetes, less than type 2 diabetes, especially less than 5 years of duration. Those who are not having any other comorbidities, those who are not having any end organ complications, those who are not on maybe higher dosages of insulin. These are definitely the category where a remission can definitely happen and worth a try with good lifestyle practices from your doctor.
So let's try to paraphrase all this जो डॉक्टर साहब ने अभी कहा. एक तो धवन साहब बता रहे हैं कि उनका वेट है 80 kg and height है roughly 162 centimeters. So this will come in over obese category. And from an Ayurvedic perspective, it will be a kapha dosh or kaph. And we'll talk about how we can use gustatory medicine to help Dhawan Saab. Dhawan Saab ne point out kiya hai, and see, look at the insight. I think that my brain is demanding more of carbohydrates. So, or there may be a problem with cortisol. So let's just park both of these sentences or these comments for a few minutes. Dr. Prem ne jo kaha, if you are able to fill the A, B, C, D, E criteria, there is actually a good chance that your diabetes may go into remission. A is for age. You are an adult of young age. बच्चे नहीं हैं. Adult या adolescent of young age. B is for body weight, which is high. So young age, high body weight, and you are willing to bring it down. You are willing to do what it takes. C is for C peptide, which talks about the pancreatic reserve. अगर आपको type 2 diabetes है, C peptide is adequate, then there is a good chance of remission. So A for young age, B for high body weight, C for C peptide. C is also for complications, lack of complications. And D is for duration of diabetes. तो ये जो ABCD formula है, this was created by a scientist called Lee. Low age, high BMI, high C peptide, low duration. इसमें हम एक E ऐड करते हैं, E and F. E is for education, enthusiasm, energy, engagement. If you engage with your doctor, like with Dr. Prem, then there is a full chance of remission. A, B, C, D, E अगर आप fulfill करते हैं. But याद रखें, you cannot do it alone. One best example we have is Swapna Jain ji, who has not only taken care of herself, but her entire family. F is for family. If the family support is there, social support is there, certainly we can go into remission. So thanks, Dr. Prem, for highlighting this. Dr. Prem, अगर हम remission की बात करें and diabesity की बात करें, are there any drugs now which are physio-friendly? So what does the term physio-friendly, psycho-friendly, person-friendly mean to you? And are there drugs which are physio-friendly? They take care of the beta cells. हिंदी में अगर हम बात करें या हरियाणवी में, वो हल्का हाथ रखते हैं beta cells पे. They don't bash up the beta cells. Halka hath
Right.
means they just take care of them. So can we
Correct.
use physio-friendly drugs to enhance the chances of remission?
Definitely, sir. As we know, I mean, the pathophysiology, जो हम बोलते हैं, I mean, in the doctor circle, we always talk about pathophysiology of type 2 diabetes. There are a lot many pathways which are involved in the type 2 diabetes, and physio-friendly or the physiologically friendly mechanism. That means drugs like the GLP-1 agonist, which I was previously putting it up. GLP-1 agonists are definitely very much useful because they bring down the weight to a good extent even up to the range of more than 10%. And some of the recent drugs which are not available in India but available in the United States and the Western world, they have been shown to reduce the body weight by 15 to 20%. So that is a quite a good number, even almost equivalent to the bariatric surgery weight reduction. Of the surgery without any surgery, the medicine is going to bring down your weight to such an extent. This itself will change the body setting, and also it will lead on to, it can lead on to the remission of the diabetes. So weight loss is definitely very important, because not only the remission of diabetes, because there is another organ also, that is a fatty liver, because fatty liver and the leading on to end stage liver disease. So the cirrhosis is also very quite common, especially in this era. And so when you're reducing your body fat, it is going to reduce the liver fat also. In turn, that also reduces the risk for the progression of the liver disease also. So yes, as I was putting in, a physio-friendly agents like the GLP-1 are definitely very important. And there are other molecules like SGLT2 inhibitors acting on the kidney and flushing out the glucose through the urine. These are also agents which are now very much in practice. And also it will also help in bringing down the weight, and in turn it also brings down good benefit for the heart, kidney, and all the also the metabolic parameters. So these newer agents are definitely very much useful. And apart from the GLP-1 agonists, there are now dual agent, as sir had initially put up, the tirzepatide is also now very much in use in the Western world. Up to 20% of weight reduction has been shown. So all these agents have a chance that if you are along with the ABCDE, it might put your diabetes into a sleep mode, that is a remission.
So that is a ray of hope. ये एक आशा की किरण है, and thanks Dr. Prem for making it so simple for us. So now if we fulfill this ABCDEF criteria, we can actually go and speak with our doctor and we can start a conversation. Dr. Sahab, Madam, Sir, do you think that there is a chance of remission? I am willing to do what it takes. And what are the physio-friendly drugs that are available in our part of the country or in Nepal? And then we can begin using those. Swapna Jain Madam was first off the block, and she identifies correctly the six tastes of Ayurveda: sweet, sour, salty, pungent, bitter, astringent. Now, what gustatory medicine says is, and I will repeat that this is an Ayurvedic concept backed by full good common sense and good clinical sense, but we need to do research on it. अब धवन साहब की complaint है, my brain is demanding more of carbohydrates, more of sweets, which is madhur taste. But how do you counteract that? He's an overweight person living with overweight or obesity. So the treatment here from gustatory medicine is pungent or bitter foods. Pungent in Sanskrit is katu, and bitter is tikht. What are the pungent things that we can take? So Dhawan Sahab, if morning, evening, night, before each meal or along with each meal, we take more of garlic, ginger, and onions. These are pungent, along with pepper. So easy to remember: garlic, ginger, onions, that's three. Red pepper, green pepper, black pepper. All these are pungent. If you take these will actually help your metabolism. And you will find that gradually you will get weaned off that carbohydrate addiction. We can also take more of bitter foods, that is thick. And here again, three things to remember. One is turmeric. The other one is green vegetables, like maybe like bitter gourd, and then herbal tea. How do you use these? You can take turmeric in your milk. You can take turmeric water with hot water. In Haryana, turmeric milk is haldi wala doodh is a treatment for everything, and it actually helps. It has anti-inflammatory effect. Our patients with osteoarthritis, they swear by turmeric milk. There is turmeric latte, which is sold in the West and sold at astronomical rates. Now, when it comes to a sabji like Karela, now to be honest, my favorite food in the entire country, either it is Odia cuisine or Malayali cuisine, Keralite cuisine, because the coconut oil is so tasty and there is so much of cream in everything there. But when you are making Karele ki sabji, if you do it in the traditional North Indian style with lots and lots of oil, then your metabolism will go for a toss and you will become overweight. So how do you take these bitter things? Maybe you might take Karela, sort of peel it, put it in the pressure cooker and maybe give it two whistles. So now your Karela is ready and you can eat it if you want. Zero ghee as of now, or zero oil. But then you can make bharwa karela or stuffed karela the same way you would make a bharwa shimla mirch. You can put in potato, mashed potato. You can put in mixed vegetables. Uh, you can put in grated coconut if you wish, or you can put in some dal of the previous night, and then you have a wonderful dish with zero calories. So, for Dharvendra ji, jo question tha कि my brain is demanding more of carbs, the answer is yes. And these are some suggestions from gustatory medicine: increase pungent and increase bitter foods. Just promise yourself, before each meal, I will take a bitter or a pungent thing. Along with each meal, I will take more of bitter and pungent things. And you will find that then your brain will be very happy with onion and garlic and turmeric. So that's the way to go. Manasa Thapaji, thank you. And this is suggestion from Nepal. Fenugreek also. Fenugreek is another thing. Methi. So Dr. Prem, your suggestions. We are talking now of bitter and pungent things. And what is your favorite cuisine, first of all?
The favorite cuisine, if you ask me, all will be carb only, as like any other common public. Definitely, carbs are definitely the favorites for anyone. But yes, putting it up, I mean, I restrict the usage of the carbs or reduce the carbs. And as far as rice is concerned, we mostly use of the commonly called as the brown rice or the red rice in this part, which has a better fiber content than the pure polished rice. And morning breakfast, I take muesli, which is not at all any sugar added, mostly rolled oats, steel cut oats, and a mixture of flax seeds, chia seeds, and all muesli is available. Yeah. And putting it up in a 100 or 120 ml of milk, soak it and consume it. And along with that, I take eggs. That is what definitely will be there in the breakfast. Two eggs for minimum, and along with the yolk also, because many people have the concept that yolk should not be taken, and with the present day concept, yolk is definitely considered to be as a good fat, so yolk can be consumed, and maybe a portion of fruit. So this is a usual routine breakfast. And when I get craving for dosa or idli, so what I do is that portion size will be definitely cut down. So maybe one idli, that's it, and along with the other maybe as I putting and some muesli or even some salads or like that, it will be added up. So cravings definitely yes, as Dharmenji was putting it up, cravings can happen. So cravings have to be controlled also for a better quality of life. And so this is the usual routines. And dinner mostly something like a roti and all. And salad, make sure that colored vegetables. I mean, different color of vegetables are there, because each vegetable, as I was putting it up, also like it has its own benefits and values. So more of colorful salad is also definitely going to help each one of us.
That sounds like a very healthy kind of a thing. And you've mentioned rightly, if there is a craving, you eat something, but you take it in less quantity.
True, sir.
Thapaji has this wonderful idea from Nepal for us. First of all, fenugreek. They said that you can use
Yeah.
fenugreek. Secondly, there is this recipe for a chutney, and we'll call it Manas's chutney. You boil karela. So you boil karela, boil and mix with sesame seed paste. इसको
Mm.
हिंदी में कहेंगे तिल के बीज.
Yep.
So Karela plus til ke beej and lemon juice. You put it all together. No oil, no spices also. There's no need for spices as well. And it's very chatpata. So this will give you a good taste, and it will also reduce cravings. It will reduce hunger. So thank you so much. I've learned something new. Will you try it
Sir,
tomorrow,
this
Frame?
part, we put fenugreek in the duff, especially the idli or the dosa duff.
Yeah,
When we make it, fenugreek we add it.
that's a good idea. You can add fenugreek to the batter as well, and it
Yes.
will give a different taste. Question is, what about millets? So, are millets a substitute for rice and wheat, or can we add millets over and on top of whatever diet you have described?
A substitute for rice, I would put it, sir, because millet is also not a holy grain. Because many people think that millet does not contain any sugar equivalent at all. It is zero sugar equivalent. You can consume as much as you want. No, it's not like that. So the basic concept is that commonly we use rice, and especially polished rice, which has a very high glycemic index, and the glucose levels can go heavier. So instead of the polished rice is what we can consider the various types of millets that are available, and because it has a better fiber content. So when the fiber content is more in a food, the glycemic spike or the glucose level, the glucose spike that happens will also be slowed down, or the peak will also be cut down, so that the even if the patient is a person is on medications, the effectiveness of the medication will also be improved by using the fiber containing food. So that is the basic concept about millets.
One of my favorite pseudo cereals actually comes from Nepal, and this is Dido. Dido is a dough, and since Manas is with us, perhaps they can speak in more detail. But when I go to Kathmandu, this is what I like the best. I like the Nepali sag, the Nepali greens, which are very filling, and they have fiber and they have water content as well in them. So you feel very full,
Right,
and I don't feel the need for any salt or pepper along with that. And
right.
then Dido is buckwheat flour. This is gluten free,
Mm-hmm.
it fills you, and you can pair it with anything. You can pair it with vegetarian food, with non-vegetarian food. You can pair it with a curry or with a dry sabji, whatever you feel like, even with curd if you feel like. So a
Right.
question to everyone, especially to Manas, because they're there, and to Swapna madam as well, to everyone, any best recipe from your part of the country? We are talking about diabesity. How can we prepare something tasty which fills our stomach, prevents those hunger cravings, and helps Dharminder Dhawanji reduce his weight and his glucose. HbA1c 13 है, we have to bring it down to below 7. So let's look for other recipes and see what happens. In the meanwhile, Dr. Prem, अब हम बात कर रहे हैं diabesity की. We've realized diabetes is two diseases put together. We can manage them. The principles are the same. And
Correct.
we are lucky now that we have drugs which are able to manage both diabetes and obesity together. You also said कि diabetes अगर हो तो ज़्यादा upset ना हो. If you fall in that ABCDEF kind of bucket,
Oh,
then
yep.
there is actually a chance of remission. But at the public health level, what is going on at the level of South Asia, Nepal, India? Are we heading for a bright future, or what's going on?
Sir, the social media, as we see, there is a lot of buzz about diabetes reversal, or the terminology that they use is reversal, and this is being capitalized by many, I won't say, would say non-doctors, or there are now new terminologies like the life coach or the health coach. Even they may not be having a qualified nutrition a certificate too, but everyone is becoming like a health coach or a life coach, and everyone is trying to exploit the terminology of diabetes reversal. So the right thing, as we were discussing, is a diabetes remission, and that is not for all, isn't it? And but the thing is, the sad thing is that many some of the patients, I mean, everyone will go for a try, because looking at the advertisement, like say for example, 40,000 rupees for 3 months, and your diabetes is gone, and you can take whatever sweets you want. So people will definitely go for a try, and after many of them, what is that, they land up in trouble and they come back. So I would say that don't fall for the social media ads that you see. Get in touch with your concerned treating doctor, an endocrinologist or a physician who is treating you for diabetes and obesity, and get the opinion whether are you a right candidate for a remission. If the doctor says yes, you can, then get the opinion from the doctor, and along with the team of the nutritionist, go for a try for the remission of diabetes. So this is what is required. But the problem is happening is that what we are, in what way we are heading is the other way around, and that is actually creating more troubles only, because more people are we are getting into complications and ending up in other specialties with the complications like that, maybe a retinopathy, bad retinopathy affecting the vision, or even nephropathy and dialysis. We know 3 to, I mean, the 30 to 40 percentage are ending up with a CKD and more are progressing into dialysis, because every center who is initiating dialysis is now increasing the number of the dialysis machines. Why? Because they're all people living with the complication or the end-stage disease is increasing. So likewise, every specialty, the complications are also increasing. So it's very important that get a right opinion from the right doctor, so that the life is safe.
And well taken. And Swapna Jainji shares a recipe from Tamil Nadu, bisele bath, which is there in entire South Asia.
Uh,
Rice plus dal plus vegetables served with raita.
yes, sir.
Again, very
Karnataka.
filling. Yeah, Karnataka dish.
Yeah.
Low glycemic index and high in satiety. And she says that senior Jain Sahab likes bisele bath and his glucose level is just 140 to 160 after lunch, even if he takes a full serving of that.
Yes, sir. Because I
Dr.
can.
VK Goyal has a question, and thanks. So we have an invitation from Nepal because the Nepali saag is in season now, right now. So we need to go there. Dr. VK Goyal has a question. Sir, you spoke about yolk egg. So can you speak again out about egg white versus egg yolk versus whole egg? What should we take and how much can we take?
Yes, sir. So what I mean, we do not get any strong recommendation from any bodies on how much eggs that you can take. I mean, to my knowledge, I do not have any guideline recommending on that. If sir knows, definitely sir can enlighten me also. But 2 to 3 eggs per day is definitely fine, and at least 2 egg yolks per day should be fine. Is what I have perceived, and that I suggest also and practice also.
Hmm.
So, sir, your opinion, sir?
I fully agree with you. And two eggs is going to give you only 12 grams of protein, not too
Correct.
much. And
Correct.
the average Indian Nepalese person needs 70, 80 grams of protein,
Correct.
depending upon your body weight. So even if you take 3 or 4 eggs, it's not too much.
Correct.
And there are many causes of cholesterol. Egg would be one of the smallest of them. Dietary overall is less. When you
Correct.
are eating rusks, that has got palm oil. When you are eating all these fried savories, they have got oils and ghees, so they increase the cholesterol. Dr.
Sir,
Goyal
overall,
sir has another.
but
Yeah,
we when you talk about the diet and cholesterol, as you were putting it up, the proportion of, or the contribution of diet to the bad cholesterol or LDL cholesterol is hardly, I would say, 10 to 15%. Because when we talk about statins, all the patients say that, doctor, I will change my diet, I will be more vigilant on my diet and all. But the very fact is that the effect of diet on the cholesterol is very meager, isn't it, sir?
we tell them actually that this cholesterol is coming from the liver, so it's not your fault. Now the
Correct.
liver is a bit naughty, थोड़ा सा चंचल है, तो उसको ठीक कर देते हैं, दवाई दे देते हैं. So that is how
Right.
we explain.
Right, sir.
Dr. Goyal sir has another question. He says at age 70, what should my target HbA1c be? Living with diabetes.
Uh, so yes, I mean, we always target an HbA1c of 7 or less than 7%. That's a blanket statement, but age, depending on the age, the comorbid illnesses, and the depending on the glycemic variability, uh, the targets also do vary. So if a person is having is 70 years and is fit and fine and is all moving about, and as said, the fluctuation variations are also minimal, no hypoglycemia. So without having a hypoglycemia and HbA1c is less than 7, there is no problem at all. That is good only. But if a person is having recurrent hypoglycemias with the multiple medications or even multiple doses of insulin and having hypoglycemia, so on the case-to-case basis, the target also should be reassessed. The person is having CKD, creatinine is 5, and I mean targeting an HbA1c less than 7 for that person is not a good option. So in that situation, maybe we can ease out that an HbA1c less than 8 without hypoglycemia. That will be much more prudent way than going in for a tight glycemia. So it's all depending on the age and the comorbid illnesses and other clinical factors that the HbA1c target can be reassessed.
Dr. Pawar sir adds that sir is 75 years young, Dr. Ramesh Pal Singh Pawar, and he
Right,
has been able to maintain his A1C at 7 with a
right.
single tablet of metformin and glimepiride. Of course,
Good.
he says, I make sure I take healthy food and I exercise for about 1 hour. So that's the
That
secret actually.
yes,
And
that's
he's able to live healthily even though the weight is a bit on the higher side. It's 114 kg.
oh right.
At age 75 सर there is something known as metabolic set point. तो एक ये metabolic set point होता है, हम सभी के दिमाग में, ब्रेन में होता है. ब्रेन में एक ग्रंथि है जिसको हाइपोथैलेमस कहते हैं, और ये कोशिश करता है, ये हाइपोथैलेमस, कि आपका वजन ना ऊपर जाए ना नीचे जाए. जैसे बॉडी का टेम्परेचर एक पर्टिकुलर लेवल पे सेट होता है, या आप अपने एसी का थर्मोस्टेट सेट करते हैं, इसी तरह से हाइपोथैलेमस भी कोशिश करता है कि वजन ना ऊपर जाए ना नीचे आए. So at age 75, since all the other things are perfect, it would not make sense to be too aggressive and to fight weight. However, for younger people, let's say someone is 15, 25, 35, 55, then certainly we can take some of these GLP-1 receptor agonists and tirzepatide, which Dr. Prem has spoken about. तो वो फिर हम certainly recommend करेंगे. Ritu Kumar ji ka question tha, how do I get rid of sweeteners and sugar free? So that we answered through gustatory medicine and try to develop a liking for bitter and pungent things, and you will actually begin enjoying life. So many questions coming up, Dr. Prem, but finally it revolves around the same thing. Diabesity में weight भी कम करना है, sugar भी कम करनी है, and all this
Right.
requires motivation. So the
True.
last question for today, coming from entire Nepal and India, how do we motivate ourselves to reduce weight?
So very I would say tough way. Keeping ourselves motivated will be like setting up goals for yourself and for a better future, and I mean revising your goals at time to time, and keeping yourself fit and happy is definitely what we need, because I mean everyone has their own, I would say, areas of interest, and so similarly, so I mean, and even trying to learn out new things also, so keeping yourself busy, and these are some of the ways I think maybe I did not answer right about the motivation, but these are things that I keep myself to go forward, sir.
Hmm. No, the answer is right, and we need to learn from each other. And then motivation भी, it is not a cross-sectional thing. It's not कि आज किया और कल नहीं करना. Just like living with diabetes, living with obesity, living with diabesity is a lifelong process. ऐसे ही motivation is also a lifelong process. So, Dr. Prem, this motivation, is it always going to be static? Is our weight and glucose level going to be static, or will there be ups and downs? And how do we handle these ups and downs?
There will be like ups and downs or the peaks and troughs, and I always ask say patients, if you when you are standing on a beach, there will be ups and downs, so that tide can go up and it can go down. So similarly, the weight and HbA1cs also can have fluctuations, no doubt. And another important thing with the diabetes or obesity is that every person in the world is not going to live with an ideal body weight. So this is also something that everyone has to understand, because ideal weight, body weight is always a concept. So even with an ideal body weight, there is a chance for diabetes, and even with obesity, you may not even develop diabetes also. So there are chances on either side. But cutting down the number in the number of numbers in weight in obesity, studies have shown it can reduce the risk for many of the problems like the diabetes or the onset of diabetes or even the complications and all. So it's very important that we look on either side, and it's not like I mean, because many people are worried after doing all good lifestyle practice and even the physical activity, my weight number is not coming down. So that is also that also worries many other people, because sometimes they may not be able to use a GLP-1 agonist and all. So, and there are people even after using GLP-1 also, their weight has not come down. So everything can happen. So it's all about ultimately, I mean, making sure that the complications are not developed, and you are living your life happily with less or least morbidity. So
दैट इज वेल स्पोकन। तो सभी की अपनी जिंदगी है, अपना शरीर है, उसका ख्याल रखना है। वी हैव टू टेक केयर ऑफ दैट एंड वी हैव टू लिव आवर लाइफ टू द बेस्ट पॉसिबल। किसी किसी की मॉर्बिडिटी दिखती है, सो यू कैन सी दैट द पर्सन इज लिविंग विद ओवरवेट और obese। किसी की नहीं दिखती, द पर्सन may choose to tell you about diabetes, may choose not to tell you। someone else may have a skin disease that is visible क्योंकि वो चेहरे पे है, another person may wish to hide it under a cloth। So but everybody does their best and I think that is the aim of KK Med Talks कि हम इकट्ठे चलते रहें, we work together and we walk this journey of health together। इकट्ठे चलें और सेहत की तरफ बढ़ते चलें। We have Batul with us backstage, and Batul and her team work selflessly to make sure that KK Med Talks come to you. Batul, would you please like to issue a certificate of appreciation for Dr. Prem Narayanan? And that's it. Thank you so much, Batul. And
the
Dr. Prem, it's been great having you with us. First of all, we want to know what does the word Prem mean and how do you use that in your personal life?
I mean, word meaning everyone knows. Okay, Prem means love. And what I tell my friends is that what how I keep myself going is that I love being loud.
Mm.
So in two ways it can put it up. The loud can be LOVED. I love being loud by my colleagues or friends or in other circle, and I love being loud also. LOUD. That's it.
So, in this KK Med Talk show, this we have achieved. Dr. Prem, without being loud, has been able to put across his his ideas, his concepts, and we all love your concepts, Dr. Prem. Thank you.
Thanks, sir.
Swapna Jain Madam says she specifically likes the example of beach waves, the
Right,
need to accept balance and to live a happy life in spite of and along with the ups and downs.
right, sir.
This I learn, Swapna ji, from the Gita as well. So the Gita talks about being sattvic and not being tamsik rajsik. But अगर आप ध्यान से पढ़ें, it says कि यदि तामसिकता राजसिकता आ गई in life, if there are ups, that is rajsikta, and downs, that is tamsikta, you happen to exhibit a tamsik or a rajsik behavior yourself, or you are confronted with something that is tamsik or rajsik, you manage that also with सात्विकता। अगर कुछ हो गया तो हो गया, you just move ahead। So that is the way to move ahead। And thanks to Thapa ji as well from Nepal for having enlightened us। So Dr. Prem, before we conclude, any final comments from you?
Yes, sir. So we were talking about the topic today was diabesity. So this twin epidemic does happen, and we'll be seeing it in our routine practice also. So again, I would say what is that a good lifestyle practice or GLP is very important, and wherever necessary, get advice from your doctor for a GLP-1 agonist also, because both these things together can definitely bring you in certain some patients it has created even wonders, I would say good amount of weight loss up to 20 kilograms, 30 kilograms and all, and remitting the diabetes and all other lifestyle problems. So it's very important that going for scientific backed up treatment practices, because as far as lifestyle illnesses are concerned, we see a lot of unscientific practices being happening in the social media, people getting treated themselves after seeing videos, and even there are many companies selling lots of powders through the social media for weight reduction, diabetes and all, and I mean they are getting benefited, but you are losing out your life on the other way, or on the other half. So be I would say vigilant, and use your wisdom when you are going in for treatment practices, and get your opinion from qualified doctors, so that you don't end up on the losing side treating in for lifestyle diseases. Thank you so much, sir.
Thank you so much, Dr. Prem. Thank you, Shukriya, Dhanyavad,
Thank
Thara
you,
Bhala ho, and Jai Hind.
sir. Good night.